Hi, I'm Rick Dancer. Welcome to the Water Cooler. Joining us now is Senior Public Health Officer Dr. Patrick Ludke here in Lane County. Thanks for joining us today. We're going to talk about tobacco and smoking. We got some new figures out, a new way of going about this and kind of reaching out to people, because what you've discovered is that education doesn't really stop people from smoking. It's not enough.
That's true. And we say in this business that tobacco use is not a knowledge deficit disorder. Many people know that tobacco can cause health problems, and that's not enough to help them quit.
So what do? Access is one.
One of them is access to the product or exposure to the product in terms of secondhand smoke. We need to decrease the exposure. We need to decrease the access to the product as well, especially for kids who shouldn't be getting access to these products at all.
Now, how do you get folks that are non-smokers to understand, interested in this issue, because it really is costing us, all of us in Lane County, a lot of money and lives?
Well, that's a great question. I mean, we're in a period of our nation's history where the economy is pretty tough right now. Partisan politics are pretty tough environment for us to work in. So getting people interested is really a key issue. And in reality, it is not that hard to do if we just find the right points to talk about. One of them is cost. Tobacco use costs society, period. People are paying for health insurance for themselves. They're paying for Medicaid and Medicare for others for their health insurance. And people who have tobacco use habits have much, much higher rates of use of the health insurance industry. And we're paying for that. So that's a big issue.
And a lot of deaths in Lane County can be attributed to tobacco use.
Indeed. About a quarter of all the deaths in our county are attributed directly to tobacco use in our citizens.
Okay, so what do we do? What's the plan in Lane County in terms of public properties, public buildings that Lane County owns?
So you hit on the first point. We want to take a look at the footprint that we control in the buildings that are county buildings and their perimeter, their yards, and make them all tobacco free. The Department of Health and Human Services within the county government is moving in that direction. We're 80% or so there. We have a few more buildings to get tobacco free, so that's the first thing we're going to do.
Now, I've heard talk, and we've seen some of the controversy about people talking about county parks and other county properties. Mm-hmm. Where are we going with that?
Well, we're studying it right now. We had our first sort of community conversation, a town hall meeting to talk about what we could do, what we should do. Got a lot of conversation from the community recently around the issue of county parks being tobacco free. So right now we're studying it. We're getting input from all of Lane County citizens and trying to decide what's the best way to go.
What do you say to those folks who say, you're stepping on my civil liberties. I live in America. I have a right to smoke. What do you say in terms of county property with that?
Well, my role as the public health officer for the county is really based on science and based on informing our elected officials. And I look at the scientific data, and I want to make sure that we are practicing public health to address the health and well-being of all Lane County citizens. Some of those citizens are smokers, most of them are not. So we need to take into account the science and to take into account the needs of all Lane County citizens. So that's what I would say to people who say, well, you're trampling on my civil liberties.
What can people do? What can I do as a citizen to get involved in this or to understand more about it?
Well, first of all, you can be informed. You can come to our website at Lane County Public Health. You can look at the Center for Disease Control website around tobacco. You can get a sense of what the policies are in your workplace. We really want to focus on workplace too. That, of course, is something the county doesn't control, but we want to impact the policies at workplaces around tobacco access, tobacco use. And they can get involved in their workplace and say, gosh, I see the data around tobacco. I see what it's doing to myself, my kids, my fellow citizens. I really want to improve my workplace. And they can do the same within their schools. They can improve the issue around tobacco access, tobacco use on school property, especially after hours where it's not so well controlled.
And you guys really do. You can put them in a program. You can tell them kind of what they need to do to get that process rolling and moving.
That's exactly right. We in public health, we have a tobacco education program, and we have a system that we use that's nationally used and nationally validated. Works quite well, and we can help everyone out in the community to move forward in that regard.
All right. Hey, thanks for being with us on the Water Cooler.
It was a pleasure. Thank you.
We'll be back.